Operating theatres like this one at the Royal College of Surgeons in London are increasingly being fitted with robotic instruments, which allow surgeons to control tiny flexible tools deep inside the patient's body.
This new technology has moved things forward in the UK tremendously since it was introduced just about a couple of years ago. We did the first one. We've now done, in this country, we're doing about 800 of these cases every year.
This week in London, a live operation at Guy's Hospital using robotic instruments was telecast to a conference of surgeons and medical students gathered at the Institution of Mechanical Engineers on the other side of the city. Among the many benefits claimed for robotic surgery are less use of pain-killing drugs and blood transfusions, with improved patient recovery times.
They have far less pain, they recover far quicker. Many patients are out the next day from hospital, whereas traditionally we would send patients out on about day 5 after open surgery. So there is less reliance on painkillers after the surgery. They're back to work quicker. And importantly, it's very rare that we need to do a blood transfusion, which patients do find rather disturbing at times.
Remotely operated tools mean that the surgeon doesn't have to be bent over the patient for hours. They manipulate the instruments from a nearby console.
The surgeon is actually not operating with holding onto tools that are actually operating in the body, but actually separated by a certain distance from the patient. And what the machine is able to do is enhance the perception of the working environment of the tool, either within the body, and also be able to change the way in which the tools move by miniaturizing motion based upon the surgeon's action. So, in other words, the robot is clearly an extension to the surgeon, but in a very precise way, as any tool would be.
As the technology continues to develop, the surgeons could eventually be in another city or even another country, opening up the possibility of surgery by satellite. Further advances are already being tested, including micro-robots that can travel through the body unaided.
We had a very slow progress in the first decade, indeed, of medical robotics, but we're now getting to the point where the robots are actually useful for the surgeon, and so we're seeing developments both from the surgeon pull side, the clinical side, as well as from the technological push. And so we're seeing much smaller devices, as we've seen this morning, being proposed. But in addition, we're seeing devices which are effectively intelligent tools that are used by the surgeon in the operating theatre to make a real difference to them.
It seems the next generation of UK surgeons will increasingly be using robots to wield their scalpels.